Hello. So for my case study presentation, I decided to do it on aneurysms because I feel like I had lacked in knowledge on this specific topic and thought this would be a great opportunity to learn more about this specific health issue. First, what are aneurysms? Aneurysms are abnormal, small or large bulges that are located in the wall of a blood vessel. There are different classifications of aneurysms based on how large they are and how they are formed. These include saccular aneurysms, fusiform aneurysms, and pseudoaneurysms. For saccular aneurysms, or sometimes known as a berry aneurysm, they are the most common, and the name comes from the shape, circular, sac-like, or like a berry. For fusiform aneurysms, they are the most uncommon, and they are the only type of aneurysm that expands on all sides of the blood vessel. Lastly, pseudoaneurysms does not actually involve the vessel wall. Blood actually leaks from the site, and then a wall is developed from the products of the clotting cascade. So what causes aneurysms and how can you reduce the risk of developing them? So you can develop aneurysms at any point throughout your life, but they are most common in older adults. Possible causes include atherosclerosis, or the narrowing of arteries, elevated blood pressure, and family health history. Some options to reduce the risk of aneurysms include eating a healthy or a well-balanced diet, participating in exercise more often, maintaining a healthy weight, and avoiding or quitting smoking. So there are multiple areas in the body where aneurysms can be developed. This includes the aorta, that would be known as an aortic aneurysm, as well as the part of the aorta that passes through the abdomen. This would be an abdominal aortic aneurysm. The part of the aorta that passes through the chest, this would be a thoracic aortic aneurysm. And then blood vessels to the brain, probably one that you're most familiar with. This is a brain aneurysm. And then blood vessels in any other part of the body, that would be considered a peripheral aneurysm. For management or treatment for aneurysms, if a small unruptured aneurysm is found by a healthcare provider, the client may be placed on medication to increase blood flow and lower blood pressure. So the main goal of that is to slow down the growth of an aneurysm and reduce the pressure on the artery wall. But if there is a large aneurysm found by your healthcare provider, and then it's a higher risk of rupturing or already has ruptured, surgery may be required. The types of surgery include endovascular aneurysm repair, or EVAR. This is where a catheter is inserted as well as a graft to repair the artery. Next would be open surgery. This is removing aneurysm through open incision. Next, endovascular coiling. This is when, well, first, mainly it's for brain aneurysms, but this is when you insert a coil to pack the aneurysm and reduce blood flow to it. Next, microvascular clipping. This is also for brain aneurysms. This is when a metal clip is placed at the base of the aneurysm to cut off blood supply. And then lastly, catheter embolization. This is used to place medication that prevents the bleeding of the ruptured aneurysm. For symptoms, in a lot of cases, there's a chance that individuals might not even know that they have an aneurysm, especially if it's unruptured. Symptoms of a ruptured aneurysm, though, will come on quickly. Some of these symptoms that you may feel would be lightheadedness, increased heartbeat, severe pain in the head, chest, abdomen, or back, and then loss of consciousness. Other symptoms, depending on the location of the aneurysm, you might experience signs of shock. This includes a sudden drop in blood pressure, that clammy, sweaty sensation you get in your hands, and not being in the right state of mind or out of it. And then more symptoms include confusion, dizziness, difficulty swallowing, nausea or vomiting, swelling in the neck, and lastly, vision changes. So for exercise testing and training, I went with specifically abdominal or thoracic aorta aneurysms. So during aerobic training, it is recommended to keep systolic blood pressure below 180, and for most individuals below 160, who have an increased risk of rupture, and that would be the large size aneurysms. During resistance training, it is recommended to avoid excessive blood pressure increases and to stick around to 40 to 50% of their 1 rep maximum in their respective exercises. This will reduce the risk or any possibility of rupturing that aneurysm. So it is stated that data suggests individuals may be able to reduce the rate of aneurysm growth while sticking to these precautions when aerobic and resistance training. For my case study, my client is a 65-year-old male. His condition, he has an unruptured abdominal aortic aneurysm. For clearance, a patient was evaluated, and the unruptured aneurysm is 4.5 centimeters. Anything bigger than 5.5 centimeters, you would not be able to be medically cleared. It is stable and does not need surgical attention at this moment. Both blood pressure and heart rate are in normal range, and it is recommended that the patient monitors blood pressure before, during, and after participating in exercise. So at the end of the day, the patient is cleared to participate in exercise. His goals are to build strength and improve overall health and well-being. Next, I put my client through 3 exercise tests. For the aerobic test, I put him through a 6-minute walk test. This is to assess the patient's functional capacity and exercise capacity. Next, for resistance testing, I put him through a hand grip dynamometer test. This is to assess my client's overall muscle strength. And lastly, for flexibility, I did the back scratch test. This test tests my client's upper body and shoulder flexibility. I decided not to do the sit and reach test to avoid the possible chance of a aneurysm rupture. After completing the exercise tests on my clients, I was able to prescribe him exercise. So for the 3 modes, first, aerobic training, his frequency is going to be 3 to 5 days per week. Intensity is going to be 50 to 70% of maximum heart rate, which for his max heart rate is 155 beats per minute. I calculated this by doing 220 minus his age, which was 65. That's how I got 155. Time, each session should be 20 to 30 minutes. And then type, low impact, just going to have him walk on the treadmill. For resistance training, the frequency is going to be 2 to 3 days per week. Intensity, like I said, 40 to 50% of his 1 repetition max. Time, each session should be 30 to 45 minutes. And then type, it's going to be large muscle groups. So for example, Monday, upper body, Tuesday, rest, Wednesday, lower body, Thursday, rest, Friday, we're going to do a mix of both upper and lower. And then, of course, Saturday, Sunday, both rests. For flexibility, the frequency is going to be 5 to 7 days per week. The intensity, to the point of feeling the muscle stretch, you should not feel any pain during this. Time, each session should be 10 to 15 minutes. And then type, we're going to put him through some static stretching to get the flexibility, range of motion up. So some precautions or modifications for my client. When exercising, we're going to avoid holding breath. We know that's never great, but that's also could be known as the Valsalva maneuver. So we're going to avoid that. 2, we're going to monitor blood pressure regularly, like I said, before, during, and even after exercise. Number 3, we're going to use weight that is 40 to 50% of 1 repetition max. Just reiterating that. And then 4, monitor for symptoms of ruptured aneurysm. And then 5, we're going to avoid high intensity core training to avoid any chance of rupturing his aneurysm. So to conclude this presentation, I learned a lot of information on aneurysms and the different classifications, as well as locations, symptoms, treatment, and how to prescribe exercise to those that experience having aneurysms. The main objective that I want the audience to take from watching this is to understand the symptoms and signs of someone that may have a ruptured aneurysm. Being able to identify this can be crucial for getting medical attention as soon as possible for someone suffering from any kind of aneurysm. And then lastly, here are my references. Thank you for watching. Have a good night.